Hello, everybody. Hi, guys. How are you? Can you guys hear me okay? Okay, perfect. Hello, hello. All right. So let's get started. It's 7 o'clock, so let's begin. All right. So I wanted to introduce myself. My name is Katrina Leandre. Okay. It's nice to meet you all, and this is my phone number. So call me up, write this number down, take a picture of this number, and this is my email address. Okay, so today I want to basically get you guys organized for the review. I have quite a few phone calls every week about the review, and some people aren't successful taking the NCLEX. So we all have busy schedules and we all learn differently. So this is just one way that I find helps the students pass the NCLEX. So I want to take this time tonight to kind of just set you guys up so you'll know what the review is about and what I could recommend your first step toward getting organized and then studying and then passing the NCLEX. Because a lot of us are all over the place since we have so many different material, we have so many different reviews, so many suggestions that you don't even know where to begin, right? So to kind of just help you guys, just one way that I have learned and it helps me and it has helped quite a few students. I'm going to share it with you guys. All right, so how the course works. Okay, so we meet twice a week via Zoom. So we meet Saturday, Sunday. I got my schedule. It is official, but I had to push it back. So it's Saturday, Sunday, 2 p.m. to 4:30 p.m. Eastern Standard Time. All right, so during the review, we review 400 NCLEX facts a week. So that's 200 facts per session. So Saturday we have 200, Sunday we have 200. We're done with that client needs area. So with the worksheets, you'll have empty spaces. I'll show you. Let me show you what the worksheets look like. I emailed the worksheets to you before before the course begins. So let me show you. Oh, do I have someone in the waiting room? No. Okay, good. All right, so this is the worksheet. These are the worksheets. So you'll get a worksheet every right before the session begins because I tend to work on them a lot. If I get free times, then I'll send them a little earlier, but I normally send them before the review. Okay, so I always put, we're not gonna go past 200 facts a day. And then, so it's 400 facts a week. So you can go and you take your time and go through them again. All right, now how did I decide or who tells me, okay, this is something that I would recommend a student studying? Well, I go I go from the NCSBN test plan. The NCSBN test plan guides me. The NCSBN test plan guides you. It's a guide for us all. So it doesn't matter what school you went to. It doesn't matter if you went to Harvard, if you went to it doesn't matter. All of us have what the questions, we have the content, we have the areas of focus per the NCLEX, per the NCSBN. They tell everyone we're in a community, we need nurses. So this is basically a bridge into the nursing profession. The NCSBN test plan is your bridge, is your, okay, this is what I should be studying. It is your guide. Guys, I have taught, and most of you guys have been in my class. A lot of you guys have been in my class. I've taught for over 10 years now. And sometimes I'll go to these nursing schools and it is like, why are you teaching that? Sometimes I look at the curriculum and I'm like blown away because it has absolutely nothing to do with the NCLEX. Now, I do understand that most schools have a responsibility to transition you to the nursing floor. And a lot of schools focus on the floor. They focus on real world. I get it. I respect it. But the NCLEX is theory. All right. It is a theoretical exam that is questioning you on med surge, ortho unit, maternity, peds, OB, mental health, every medication, and pharmacological and parenteral therapies, every medication, right? So we should focus more so on the theory as opposed to real world. They don't. So you're thinking in your head, there is no guide. I just have to learn everything. Right? I have to learn everything to be successful. There is no guide. I am telling you, there is a guide. They didn't prepare you correctly in nursing school. So you have to erase whatever you're learning in nursing school, whatever you have learned. You got, no, not the material, the culture. Let it go. Okay. In order for you to pass the board, if you're having a hard time passing the board, you have got to embrace that NCSBN test plan. That's your school now. Okay. This theory of this lie, or I don't know, this misrepresentation of what nursing the NCLEX is, guys, it is a misrepresentation. And if you guys look at the NCSBN test plan before you start studying, I guarantee you, you'll be more successful. All right. So just make sure that you guys are aware of that. All right. So every week I'll send you guys the Zoom link, and I'll also send you the worksheet. So the worksheets, again, we do the worksheets. It's 200 points per session. All right, 200 points per session. So 200 on Saturday, 200 on Sunday. Our times are from 2 to 4. All right, so let's go. All right, so Saturday, Sunday, 2 to 4:30. Sorry. So you guys, we review 400 NCLEX facts a week, 200 facts per session. I have an Etsy store, but you do not have to purchase any review material for this course ever. You never have to purchase anything. If you're in the course, I give it to you for free. I do have an Etsy store that has like things like ABGs. They have little worksheets that I've done that have been successful in the past. If we're covering that material in this course, you don't have to purchase it. But if you want to go ahead, or if you need burns, if you need help with ABGs, I do have a store, and it has those things there that you can purchase, and they're like $1. Now, where is this money going? It's not. I'm going to get me a BBL. No, I'm just kidding. I'm not. Where is this money going? The money is going to go back into you guys, into the community. So this helps me purchase books for other students. It helps me. Some students haven't have to change schools, so they can't afford their transcripts. You'll be amazed at how many people are in lingo for $200, $300. So I have my niece that I'm helping for college, and I have my daughter that I'm helping in college. So I can't help everybody. So the best way for me to do it is to sell the worksheets. They're $2, $2.99, $1, but you don't have to buy them if you are in the course. Okay. All right. So permanent Saturday link. You guys will get, this is the permanent link. I'm going to send this to you. So every Saturday you have the link. It's here. I made it for the next year. So this is our link on Saturday. There's a permanent Sunday link. This is the link for Sunday. So we're back on, guys. I got my schedule. I just had to push back. It's not going to be at 10. It's going to be at 2. Saturday and Sunday. So that means that you guys can even go to church. Okay, worksheets. I'll send the NCLEX facts worksheets before the session begins. I'll send those 200 points before it begins because I like to work on them. All right. How am I using, like, how do I know, you know, if I'm not wasting your time? How do you guys know I'm not wasting your time? I go directly from the source. So this week, this Saturday, this is where we'll hit this area here. Health promotion and maintenance. This is us. You see, health promotion and maintenance. And then the next week, we'll be doing psychosocial integrity, basic care and comfort, farm, reduction of risk potential, and the big old monster here, med surge. All right. So there are little hints or little guides that I put on Etsy for you guys if you want to like prepare ahead of time. But if not, just wait for me. I'll send them to you during the course. All right, the little worksheets. But this is how our review goes. And when we're finished, we just start over. When we're finished, we just start over. It's just cyclical. We just keep going over and over and over and over and over again. It doesn't change, guys. The NCLEX, the content is the same. It's just the same recycled material over and over and over and over again. All right. When I do send the worksheets ahead of time, it would be great if you can print them. I'll try to make them a PDF version where you can type them, but I got to look into that. But for now, it would be great if you can print and write. That's active learning. It does help. It's better than passive learning. It's better than PowerPoints. All right. So what should I do after every lecture? After every session, reinforce the lecture with the Saunders NCLEX Review Question Workbook. Now, I know that many of you, the class is I'll let you know. Hold on. What time did I say the class was? (2 p.m. to 4:30 p.m. All right. All right, so that will be great. What were we? Okay, so what should I do after the lecture? After every session, reinforce the lecture with Saunders NCLEX review question workbook. Now, listen, I know that a lot of you guys have UWorld, you have invested your money into these fantastic, magnificent, well-written books. I wish I could provide questions for you guys, but I'm just not on that level. Saunders, in my opinion, they have figured this thing out. When I was working on my PhD, I know y'all getting tired of hearing about me and my PhD, but when I was working on it, I just so happened upon an article on Saunders, this workbook, everything Saunders. It is the elite. Most of these UWorld, all of these guys got the information or looked at Saunders for a template. Saunders started it all, especially that adaptive quizzing. Adaptive, for me, I would give the students, when I was a DON, I would give the students the adaptive quizzing because I know it was thorough, because I know it was fair. So Saunders is the end all be all. The reason that ATI took over was because Saunders became compromised. So people don't trust it because all of the answers are on the internet. And so I was trying to explain to one of the representatives that, hey, we can't use this because the answers are on the internet. So she proceeded to tell me, well, give me the name of the student that had the answers. I'm like, okay, well, that's where this conversation ends. The answers are on the internet, so a lot of schools don't use them, but they are the best. They are the best, in my opinion. Now, one of the nurses, and she's going to come and talk to you guys. Her name is Caitlin. She's my preceptor at Cleveland Clinic. She'll tell you she liked UWorld because she liked the format. She likes the color. She loves the layout. So when she took the NCLEX, it was like taking a UWorld. She didn't feel anxious. Some people love Kaplan. Me personally, guys, for this course, I use Saunders. It is my thing. I love it. So that's my spill on that. So if you can, if you can, please purchase the Saunders book. If you're gonna if you have an old one, that's fine. But if you don't have an old one and you have to purchase it, if you have to purchase the book, please buy a new book because you need the access code. All right, so you see, after every session, reinforce the lecture with Saunders NCLEX review question workbook. The link is here. An older additional is just as effective. You don't have to purchase a new book if you have one. If you feel the urge, if you have an old book, keep that book. Buy a new next gen book. Well, this is the price for the Saunders book. You guys know if you're taking the exam after April 1st, 2023, you'll have the next gen questions. So if you have an old book and you just need to buy a new book, buy the next generation test item book. And Heather, if you can just hold, like, don't leave, okay? Because I would love for you to share the story. Please don't leave. All right. So next generation, if you have an older edition and you need to buy a new book, buy this book. Especially if you're testing after April 1st. All right. So if you're very anxious, and most students are, about the next gen questions because you are testing after April 1st, Saunders does provide 25 next gen questions. So if you want to go in to kind of take a look at the format, how to redeem your Elsevier access code. If you have never ever used Elsevier or Evolve, I put the link here. It tells you step-by-step instructions on how to get it started. Because it's not so much the book that you need this after every lecture. You see this assessment, study, exam, categories, subcategories. This format on the computer is what you need. You don't need the Saunders book because I'm going to give you a worksheet, but you do need this access code. You do need these questions. All right. So after every lecture, you have to reinforce the lecture with questions. That's how you're going to apply those questions about restraints. You're going to apply those questions about safety and infection control. This is how you apply. Don't let the first time that you have tested yourself, when you get to the NCLEX, you should have done over thousands and thousands of questions. So this book has 6,000. So I recommend this book. Okay. So again, after every lecture, you have to use a resource. You have to use NCLEX style questions. I personally like Saunders. I know other people like UWorld. I know you may like Lippincott. That's fine. All right. This code, if you have never used Evolve, these are the instructions here. It'll walk you step by step. All right, medical, surgical, physiological adaptation. If we are studying medical, surgical, physiological adaptation for that day, look, you can go and find questions on physiological adaptation. Whatever we study, you'll always find questions in Saunders to align with what we just studied, to reinforce what we just studied. If we talk about cardiovascular, ear, endocrine, eye, everything is here. So every day, I want you guys to write this down. Every single day, you should be doing 25 to 30 questions a day. Every single day until you take the NCLEX. So how do I get questions like, okay, I read cardio, I want cardio questions, Saunders. I did ear, I want ear question, Saunders. I study endocrine, I need endocrine questions, Saunders. That's how you do it. Whatever you studied, whatever you read that day, reinforce it with questions. Medical emergencies, which is huge for the NCSBN test plan. When we discuss medical emergencies, guess what? It's here. You can go home and reinforce it with your Saunders questions. If I talk about acute respiratory failure, guess what? Go to Saunders, reinforce it. If I talk about CPR, guess what? Go to Saunders and reinforce it. Peds. All right, we're going to talk about peds on Saturday. Guess what? The questions are here. Adolescent, early adulthood to later adulthood, end of life care. We are really going to dig in on Saturday on developmental stages. But let's say, for instance, you want to look at it before. Here are the questions for you. Knock yourself out. This is what we'll be doing on Saturday. This is the worksheet that we'll be using for Saturday to really, really reinforce peds health promotion and maintenance. Now, some of you guys have taken the board and people are telling you, you need to work on your critical thinking skills. And I know you're thinking, yeah, okay, well, thank you. Thank you so much for telling me that. I appreciate your time. What does that mean? If you need help, if you really want to know what critical thinking skills per NCLEX, per nursing, per NCSBN, Saunders is a very good book. You'll do study, cognitive ability, and evaluation and synthesizing will help you with your critical thinking skills. So we'll talk about that also in this session. This is where the critical thinking comes into play, evaluating and synthesizing. They're saying that if you can take CHF apart, if you can evaluate it, take it apart and then put it back together, that's considered critical thinking. You have to just think of like, just think of you bought a very nice bag, like I guess the new bags are the Christian Dior. Am I right? Everyone has to have a Christian Dior bag. Am I right? $15,000 bag. Yeah, everybody has one. I don't know how, but that's the bag now. Let's say you have this Christian Dior bag and the handles are off of the bag and the bottom is like comes out, it detached. Critical thinking means, okay, I know this bag has two handles and I know the bag need a bottom. Boom, I put it together. Synthesizing and evaluating. This patient has CHF. His BNP is elevated. His legs he has dependent edema. He's having difficulties breathing. He's having respiratory issues. Okay, this guy has CHF. So when people say, oh, you have to work on your critical thinking, go here, try study, cognitive ability, and do like maybe 100 evaluating and synthesizing questions. Those are your critical thinking questions. You'll understand what they mean by, oh, this is critical thinking. This is my weakness. This is how you can improve your critical thinking skill in nursing. Integrated process critical thinking. Again, a lot of you guys, if you were unsuccessful on the board, you're going to get people to tell you, oh, you have to work on your critical thinking skills. All right. Here are some practice questions for you to help you hone in on your critical thinking skills. It's teaching you what critical thinking is per NCLEX. Now in life, we're all, if we're women, we're critical thinkers. We figure it out. We've been exposed to it enough. We know how to handle ourselves. So now just learn how to critically think per NCLEX. The best way to do it is through practice questions. So if someone has told you, if you have been unsuccessful, that's okay. And they're saying you need critical thinking skills. You have to work on your critical thinking skills. Go here and do these questions so you can understand, oh, this is what I'm missing in the critical thinking process when it comes to NCLEX and nursing. Mental health, we're going to have a session on mental health. That's psychosocial integrity. Once we discuss psychosocial integrity, we'll do questions on psychosocial integrity, which is mental health. Maternity, same thing. We're going to discuss maternity. Once you complete the lecture with me, reinforce it with questions. Dosage calculations. If you're having issues with dosage calculations, especially if you're taking the exit exam, there's 111 dosage calc questions in Saunders. Test taking strategies. We're going to have a session on test taking strategies. I'm going to talk to you guys about airway, breathing, close-ended words, comparable or like options. But if you want to get ahead, if you have an issue with test taking strategies, look, they're all here. Okay, airway, breathing, abnormalities exist, close-ended words, comparable or like options. These test taking strategies help. It is because of test taking strategies that I got my daughter a tutor for her ACT, because there is such thing as test taking strategies, guys. It is true. They help. So if you're having issue, if you know the content, if you feel like, man, I know this content, it's just my test taking strategies that I need to work on, here you go. Safety and infection control, guess what? We have questions here that can reinforce safety and infection control. Select all that apply, which is our favorite. You're going to get from 40 to 50 select all that apply on the board. So how do you prepare for select all that apply? You do select all that apply questions, especially the week before you test. So Saunders has 707 select all that apply, exclusive select all that apply, nothing else. So Saunders, especially remember, keep in mind, and I want you guys to write down, the week before you take your NCLEX, you should be doing select all that apply questions, and you should do mock exams. So how do you know you're ready to go to the board? How do you know you're getting better? Well, Saunders provides practice exams. They're here. If you go to Saunders, if you hit exam, you can do a 10 question exam, 25 question exam, 50 question exam, or 100. I would recommend 100. Click client needs and hit all 4 categories. You got your nice little mock exam, and you can do as many as you need. All right, this is something that you can also use to gauge how you're doing before you take the NCLEX. Okay, so most of you guys have taken the NCLEX before or not. You've taken the exit before or not. When you take the exit, when you take the exit, it's like nursing school becomes these client needs category. These are the major client needs categories. So they take everything that you learn and they bundle them into these 4 major areas here. All right. So if you're having an issue with health promotion and maintenance, you can just do health promotion and maintenance questions. If you read your report and it says below average or below requirements for physiological integrity, go in and only do physiological integrity questions. Or if it's below on psychosocial, do psychosocial questions. So Saunders helps you a lot. They break it down for you a lot. And I don't think you're going to find this with any other program other than Lippincott. All right. What if I miss the live session on Saturday and Sunday? And do I have to purchase a workbook or worksheets? You don't, even if you miss the session, you don't have to purchase the worksheets. I send them to you guys via email. Okay. If you go to my website, if you go to my YouTube channel, yes, I have links for workbooks because some people from different countries listen to the reviews, believe it or not. I have more students in the Philippines than I do in the United States. So that link is for them. If you guys are in this review, you don't have to purchase the worksheets. If you miss the lecture on Saturday and Sunday, it's on YouTube, and I make it very easy for you. First of all, make sure you like and subscribe, guys, so I can start helping people. If I get monetized on that channel, I have to get 1,000 people, 1,000 subscribers. So once I start making the money, I can start paying for students who don't have money to buy books or money to pay for that leadership course, which is like $5,000 at these different schools. And a lot of these students have been ripped off by other schools. So if I get up to 1,000 views, I can give that money every month to someone who really needs it. All right, again, so make sure you subscribe to my channel. If you missed the lecture, you can go and listen to the lecture on YouTube, and I break it down for you. I give you the timestamp. So you see here at 27:20, we talked about food poisoning. We went over fact 27 to 38. Here, 1 hour, 10-minute, 5-second mark, we discussed the disaster triage brainstorm bubbles. So if you miss a session, I'll have this on YouTube. You can just, if you just need to listen to transmission precautions, you know exactly where to red ball it to. Just get the red ball and go to 1 hour, 35 minutes and 25 seconds. All right, so if you, again, what if I miss the live sessions on Saturday and Sunday? That's okay. Go to YouTube, find what you need. In the beginning, I'm talking about the NCSBN, but if you want to start at empirical workers, you have the timestamp. So it just makes it easier. All right, also guys, I have a Facebook. Make sure that we're friends on Facebook. Just in case you miss a session, sometimes I'll start the lecture on Facebook so you can say, oh man, I should be in the Zoom meeting right now. It's just a reminder because we're very busy. So send me a friend request on Facebook. I don't go through your pictures. I'm not, hey, it is what it is. But I do go live on Facebook for like the first 10 minutes so I can kind of remind you, hey, we're going live. And this is the workshop, the Etsy store that I was telling you guys about. It has IV drip rate, a worksheet. If you're having issues with drip rate, if you're having issues with triage categories, equally divided doses, if you need infant reflex worksheets, ABGs. Now, these are things that I just typed out. Don't get me wrong. They're only like 99 cents. But sometimes you need a guide. I do feel like they're very good guides. Okay. So that is the store, the Etsy store. Okay, priority questions or recommendations. So even on interviews, even with my preceptor, she always wants me to prioritize my care. So I get report on 4 patients, and she'll always ask, who are you going to see first? What room first? And I tell her, I always go to the most critical, right? I always go to the most critical. So as a first-year nurse, guys, you have to do this. And I know that they don't focus on this in nursing school, but you have to know your priority. Like, that's nursing. They're going to give you a CHFer. They're going to give you somebody with diabetes mellitus. They're going to give you someone with a respiratory problem, GI problem. Where do I go first? So guess what? Let's train your brain. This is a book that I highly recommend. Like I say, once we get the YouTube following up, if you need a book, I'll be able to purchase the book. So try to help me get 1,000 subscribers so we can start purchasing these books for people that need them. So this is a prioritization, delegation, and assignment workbook. It helps. It breaks down priority for neuro, cardio, respiratory, GI, GU. So if you're that type of person that learns through questions, this is the book that I recommend. And I'm going to send you the link. It's a very good book. All right. Any questions so far? All right. So let me see. Okay. Okay. So how do I get organized? I am all over the place. So when students call me, and even me, this is my biggest issue. How do I get myself organized? It's so much. Where do I even begin? Right? A lot of you guys are with me with that. Like, where do I even begin? And especially if you have taken the exam, this is your biggest issue. If you have been unsuccessful on the exam, you're looking at your report and you're looking at nursing school. You're looking at your report. You're looking at nursing school, looking at your report, and you're like, man, where do I begin? So let me just tell you what I would do. This is what I would recommend if you have been unsuccessful, or, I mean, even if you have never taken an exam before, let me help you get yourself organized. So the first thing you have to do is you absolutely must download, you have to print out your NCSBN test plan. Now, how many of you guys have ever had a spa day? Anyone has ever just had a girls' day or just self-care day? Oh my. Well, B, you gotta get you have to. Oh, no, no. All right. Okay. Well, for those that have never had a self-care day is coming, don't worry. Okay. How can I say this? When you go through the NCSBN test plan, you want to have that same mentality of today is just all about me. I am not stressing out. I'm going to get away from my house, even if it's sitting in your car. Like for me, I just sit in my car on the beach. Whatever you have to do, you're going to take this NCSBN test plan and you're going to take a red pen. And you're going to go through this NCSBN test plan and you're going to be honest with yourself. All right. And if you understand the material, you'll put a check. If you don't, you're going to put a red X. That is telling you what you have to study. So here we go. Let me show you. All right. So I'm on the beach now and I'm having a spa day. Today I am by myself. I'm not with my daughter. I'm not talking to my husband. I'm not talking to my brother, my sisters. No, today is my day. So I got my NCSBN test plan printed out and I'm going to scroll down. I got my red pen. And now I'm going to be honest with myself and go through every point. And this is for the LPNs. There's an LPN, there's an RN. This is the one we're looking at now is LPN. I'm going to read it. Identify client allergies and intervene as appropriate. If I feel that I don't know anything about identifying client allergies, I'm going to put a red mark. Verify the client's identity. I have no idea what they're talking about. I'm going to put a red mark. Assist in and or reinforce education to clients about safety precautions. Oh, I know this one. I know how to do that. I've read that at length. I'm not going to put a mark. Transfer assistive devices. Oh, I know how to do that. I'm not going to put a red mark. Evaluate the appropriateness of a healthcare provider's order for client. I have no idea what a provider's order is. That goes in red. So I've taken my spa day because look how much I have to read. look at all this red ink, or there's hardly any ink. You know, I've gone through every client needs category. I've had a drink. I've gone to the pool. I've dipped my foot in the pool. I've walked around the beach, and I have completed my NCSBN test plan for that day. So to go even further, let me show you guys even more what I mean, because this is the foundation. So how do I begin? I have been so unsuccessful. I'm so frustrated. I don't know what to do. How do I begin? How do I start? Like, what am I doing wrong? So I'm going to take a special spa day by myself, self-care day. I'm going to scroll down, and for the RNs, it's page 23, but actually page 19. I got my pen here, and it's red. I scroll down, advanced directives. I know advanced directives, but when it comes to delegating, I need to work on this. I know this. Oh, I need to work on this. Oh man, I need to work on this. Oh man, I need to work on this. Oh. And then I go even further. They even break it down for me further. They're saying, okay, let me tell you a little more. Let me elaborate. Go here. Oh man. I have a lot that I need to focus on. A lot. A lot. So by the time I leave that day, when I finish my spa day, I have my reds. I have identified per NCSBN, per NCLEX, what I have. I need extra practice on these things. I have acknowledged it. I'm not just pulling it from the sky. I know for a fact I have an issue with referrals. So I'll go. That's my first day. I've done it. Are you guys with me? Okay, so the first thing you need to do is you have to identify your weaknesses. You don't need to pay anybody to identify your weaknesses. You know what your weaknesses are. It's here. If you know that your weakness is providing care and education for the preschool, then you know that. No one has to tell you that. So I'm finished. I got my red marks. I did what I was supposed to do. I know my issues in every category. There's 8 of them. I've broken this thing down. Right? I know everything. I got it. Step 2 of getting organized. Step 2, you want to buy a 3-ring binder. And I mean a 4-inch binder. Big black ones, or sometimes big white ones, but they're not multicolored because they are industrial size binders, right? So let me show you what I'll send you guys this link, but this thing is huge. Here you go. If you just copy and paste the link, it'll take you to the binder. Voila. All right, so this is a 3-ring binder. It's a 4-inch, and I gave you guys the link. It's $11. Get you this 4-inch binder. You need a big binder. All right. Your next step, after you received your binder, you have your test plan printed out, you have your binder, get you 15 dividers. So if you go here, I gave you the link, get your 15 notebook dividers. You can copy and paste it. Can you guys see those dividers? Get 15, so 15. There's 15 areas in nursing that you have to master. 15. So get 15 binders. Oh, 15 dividers. All right, what's the next step? My next step of organization, sticky notes. You're gonna buy as many sticky notes as you can buy. All right, sticky notes. Let me show you. All right, sticky notes, because you're gonna put your lab values on your sticky notes. As a first year nurse, guys, you have to know your lab value. So you're gonna get you some sticky notes, and you're gonna put your lab values on your sticky notes, and you're gonna put them in your bathroom, and then you're gonna put one set on the refrigerator. So every time you go to the bathroom, you are forced to look at lab values. When you go into the refrigerator, you are forced to look at lab values. The two places that we go most often. So your sticky notes are for your bathroom and your refrigerator. So there's an 8-pack here. You get an 8-pack for like $9, not $10. Now you can put them in systems, or like you can have the pink. The pink could be cardiovascular labs. The orange could be neuro. The yellow could be respiratory. The green could be GI. The blue could be skin. So you can put them in different categories, color categories, and it's worth it, because every question, you know, if you don't get a lot of management of care questions, you're gonna get lab values. Sorry, guys. You're gonna be responsible for lab values. All right, so make sure you get your sticky notes. All right, what's next? Print copies of your concept maps, and I'll tell you why when we get there. You're gonna need concept maps. I'll send a copy, a template, but if you work in an office, if you work anywhere where you can get free copies, make as many system disorder concept maps as you can get, and I will send you the template. All right. When it comes to that critical thinking, you need concept maps. Concept maps help with critical thinking. So concept maps. All right, so you have your 4-inch binder. You got your 15 dividers. You have your sticky notes, right? We're tracking? All right. So we got our binder, we got our dividers, we got our sticky notes. You're gonna label. These are the labels for your binder. I'm gonna tell you, I'm gonna show you guys your labels. The first label is management of care. If you are an LPN, it's coordinated care. If you're taking the LPN board, it's coordinated care. For our RNs, management of care is the first label, or it's the first divider, because that's the most important. And I want you guys to write that down. This is the most important part of the NCLEX. And notice, I see all of this here. I see physiological adaptation. I see reduction, but I'm telling you the most important part of the NCLEX is management of care. Then the second divider will be safety and infection control. Your third divider will be health promotion and maintenance. Your fourth divider will be psychosocial integrity. Fifth will be basic care and comfort. And I want you to underline basic care and comfort. And I want you to put basic care and comfort in red. Now, let me just tell you why. You guys went to, when we were in fundamentals, when we were in fundies, nursing was a culture shock. So a lot of this stuff we didn't really process correctly because we were still just trying to get accustomed to the school, the instructors, the culture of nursing. So basic care and comfort hurts a lot of students because it's the first thing that we're introduced into. So I want you to put a red next to basic care and comfort. And I want you to put skills. Those are your skills. And the most important skill of all is your health assessment. All right, your health assessment. If you go on my Etsy page, I have an example of a head to toe assessment for like 99 cents. But if you don't have the dollar, just let me know. I'll send it to you. The most important part of basic care and comfort is your head to toe assessment. And now cranial nerves, I'm talking about lymph nodes, heart sounds. So I have a little cheat sheet that I made and it's good. All right, so the next divider is farm. I have a little guide that's going to help you with farm. The next tab is reduction of risk. I want you guys to put down diagnostic procedures and therapeutic procedures. I'll send it to you. All right. So farm, I have a breakdown for you. Reduction of risk potential, I have a breakdown for you. Physiological adaptation, believe it or not, I have a breakdown for you. Physiological adaptation, that's the, so how many tabs? 1, 2, 3, 4, 5, 6, 7, 8 tabs. Physiological adaptation tab, that's peds, that's maternity, and that's adult health. Peds, maternity, and adult health. So management of care, safety and infection, health promotion and maintenance, psychosocial integrity, basic care and comfort, farm, potential of risk, reduction of risk potential, physiological adaptation. So again, where do I begin? I got my binder, I got my tabs. 1, 2, 3, 4, 5, 6, 7, 8. So what's tab number 9? Let me write this down. Tab number 9 is test taking strategies. Test taking strategies. Ten is dosage calculation. $11 is medical emergencies. $12 is burns. Rule of 9s. Burns. Rule of 9s. $13 is comprehensive health assessment. $14 is lab values. And those lab values, you're going to break them down. Your lab values: neuro, cardio, respiratory, GI, GU, hematology. So lab values: neuro, cardio, respiratory, GI, GU, hematology. 15 is your NCSBN test plan. Those are your 15 tabs. So an example, like, so how are we going to use it? So with you and I in this group, we go through a client needs area. We go through this circle. So management of care, all your management of care notes, all your mnemonics, all your pictures, every little note that applies to management of care goes in that divider, goes in that section. And we're talking about safety and infection control, especially when it comes to infectious diseases and a disaster, a triage, safety, and if everything goes into this. Even my videos that my go-to videos, I write them down and I just throw them in this section. Health promotion and maintenance. This is a doozy for me. This is all those screenings. That's when you get your immunizations. Print out your immunization schedule. All this goes into health promotion and maintenance. Education and teaching. All of it goes into health promotion and maintenance. Psychosocial is now our mental health disorders. This is where your concept maps will come into play. That's when you'll start using your system disorder concept maps. Stick everything mental health in mental health. And I want you to put down therapeutic communication. Therapeutic communication goes hand in hand with psychosocial integrity. Basic care and comfort. I want you guys to write down comprehensive health assessment. And notice I said comprehensive. Cranial nerves, lymph nodes. All right. Skills. This is where all your skills have to be revisited. And especially the AED and CPR. AED and CPR. That's a skill. Pharmacological and parenteral therapies. That's going to be your 23 classifications of pharm. 23 classification. That's how we're going to break it down. And I'm going to show you how to do that. That's your medication concept map. But I have another breakdown for you also. But medication concept map. Reduction of risk potential. That's another tab. That's all of those diagnostic procedures. Do I give this patient water? What position am I going to put the patient in when they come back? That's reduction of risk. And then the monster. Physiological adaptation, which is med surge. Break it down. Break this physiological adaptation down even further. Neuro, cardio, respiratory, GI, GU, skin, musculoskeletal. So now this is where you use that system disorder concept map. Test taking strategies will be tab 9. This is when we'll talk about ABC. We'll talk about comparable or alike options. Tab 10 is doses calc. We have to work on our conversions. We have to, and most importantly, we're going to write down all the formulas. We have to know the formulas. You're nothing without your formulas. 11 is medical emergencies. I want you to write down AED. You're going to learn that AED and you're going to learn CPR. Medical emergencies, we're going to talk about things that there's nothing else I can do. Let me call the doctor. A medical emergency is huge on the board because they don't want you there contemplating what to do during a medical emergency. Burns rule of 9s. When it comes to survival potential, we're going to talk about burns. I also have a packet of burns on that Etsy. I think it's like 50 cents or like $1. It's a packet. It gives you maybe over 200 burn questions. Do you need to know your burns? Because if someone has 60%, like if you do the calculation and the patient is 60% burned over their body, then that patient, you know, the survival potential for that patient is very low. So burns is 12. Then 13 is comprehensive health assessment. Again, its own tab because we're nurses and we have to know how to do a comprehensive health assessment despite what anyone has told you and despite what we have seen on the floor. And 14 is lab values. You will get the entire question wrong, a critical thinking question wrong because you don't remember the lab values. And 15 is the NCSBN test plan, the one that we have our red marks, our notes. That's our spa day test plan. That's our reference point. And then when you guys finish this course and you have successfully passed the NCLEX, sell your notes on Etsy because there's people making millions of dollars selling their notes on Etsy. Sell it. All right, so this is how you get yourself organized. Any questions about that? All right. So that's how we are going to proceed. Again, every Saturday and Sunday, but I push the times back. We'll meet and we'll go around that circle. You guys have the link. We just keep going around that circle, the NCSBN circle. I've given you guys the recommendations, the books that I would purchase. All right. Please join the please like and subscribe to my YouTube channel, guys, because if I get 1,000, and if you don't, if I get 1,000 and the amount of views, if you don't have a book, I can purchase you a book. Okay. So just everybody, let's say, for instance, if you're having issues purchasing a book, the best way to get your book, I'm telling you now, get as many people on my YouTube page as you can. Within the next month, I'll be monetized. I will buy you a book. I'm gonna buy a lot of books. All right. So that's how we get ourselves organized. Get your binder, print out your test plan, have a spa day. Make sure that you go through your NCSBN test plan, put your red marks there. 3-ring binder, 4-inch, get you 15 dividers. I told you which every section should be labeled, and purchase your sticky notes. I went over the questions after every session, where the questions are. I'm going to send you guys the video on, if you've never been on Evolve, how to access, like how to use your access code, how to input your access code. And after that, guys, the rest is just up to me to give you guys the worksheets, and we go over the worksheets together every week. So on Saturday, we're doing health promotion and maintenance. All right, I'm going to stop this recording because I'm going to put this on YouTube also. So if you want to listen to it later, you can, and I'll put the timestamps there for you. And then I'll let you guys